Welcome to another edition of the ConCensis podcast. I'm your host, Amy Shadroff. Our guest today is Dr. Arpita Hazra. She is the clinical patient safety data specialist. And today we're talking all about patient safety and risk management in healthcare. Doctor, welcome to the show.
Hi, Amy. Thank you for the introduction. Just giving a little background about myself. I'm a physician and I started my early career on the internal medicine floor and then went ahead and got my master's in public health and have since transitioned into research and clinical data science and have worked with various health systems across the country. In my present role, I work in an insurance company as a clinical patient safety data specialist, and my projects involve risk management and patient safety.
Perfect. To start with, can you give us an overview of the biggest risks that hospitals and surgical centers face in sterile processing and perioperative safety?
Sure. When we talk about sterile processing, we have to understand that it involves various steps and processes, and it is very important for all surgical patients that everything is done correctly because post-op infections are a known risk, and we do commonly encounter this in patient care. And why post-op infections are so important in terms of risk is because once patients get infection after the surgery, it increases their length of stay in the hospital. They tend to get readmitted back into the hospital. They might be back in the OR, and it increases chances of adverse patient outcomes. Also costing our health systems more than it should. So, doing the sterile processing correctly in the beginning and doing everything we can to make sure that all steps are followed will help with reducing the post-op infections. And the second part, like perioperative settings, another important thing that I've noticed is we have issues with surgical instruments. So I'll explain two case scenarios to you that I have commonly witnessed. So one of them, suppose there is a retained foreign body. So many times it does happen that there is a retained foreign body and the patient goes back to the OR for this. When we go back and look at the notes in the EMR, we realize that all the counts were done correctly in the OR, and there was nothing that was noted out of place, but still something was left in the patient. So yeah, counts for surgical instruments is very important in perioperative setting. And the second scenario that I've seen in terms of surgical instruments and devices commonly is sometimes the instruments or devices can get damaged. For example, I've seen the drill bit gets broken in while during the surgery and is left in the patient, especially during orthopedic surgeries. I've seen that happen, and this probably could have been prevented in some instances if we inspected the device or the instrument more thoroughly before the procedure. Not everything is preventable, but just sharing what the risks are so we can be more mindful of what we can do to improve patient outcomes.
So how are AI and digital tools changing the way healthcare organizations manage and reduce this risk? I mean, is AI able to say, hey, you left a sponge in someone's abdomen?
Not AI, but RFID has been used successfully in a lot of health systems for sponges specifically. So that has been successful. And we have numbers to prove that, it has reduced the retention of sponges after surgery. So that is one thing. And now with more technological solutions and AI coming into play, we can actually go one step further. So RFIDs have been in use for a while, but now we are able to integrate it with our systems, collect data, do more in with that same technology than we were able to do in the past. So, in terms of AI helping with risk reduction, something it can really help with is better documentation. So when humans write documentation, like after the procedure, the operative procedures, the surgeons will write their notes, the OR tech will write their notes, the Nursing staff will write their notes. Of course, it's a multidisciplinary team and everybody will write their respective notes, but they can be subjectivity. So AI can come here and help us, with the documentation. So it'll reduce inconsistent documentation, the missing documentation that can happen. And apart from that, sometimes we miss some important um, pointers in the documentation. So AI can make sure by adding prompts like, maybe you should add this. So that's one place where I can see AI reducing risk. So apart from knowing having the RFID to see that the sponge is removed, we also can document it in an automated fashion because of AI now. Then AI also helps with data collection and predictive analytics, and it helps us pinpoint where the issues in a particular health system arise. Like if only if we know where the problem is, can we solve it? So many times this data-driven insights help drive actions in healthcare systems in terms of policy change or introduction of new protocols. And I see that's very valuable and it will improve patient outcomes going forward. And also another thing that I found very useful, so when we talk about risk, communication and documentation keep coming up repetitively because these are the most important things we can do in the healthcare setting to reduce risk. So, in terms of communication, so AI has enabled us to integrate scripts for providers or templates in the EMR that they can use to have conversations with patients and document the conversations. And these conversations are very important because once the patients understand what the procedure is, what the risks and benefits are, what are they walking into, they have better expectations of the outcome. So like I was previously talking about post-op infections, if the patient is aware this is a possibility, of course we will do everything on our end to minimize it, but then they are not shocked and it may not lead to a lawsuit because they have an understanding of the process and the risks with it.
Speaking of lawsuits, we know that human error is one of the biggest factors in medical malpractice. How can technology assist teams in catching and preventing those types of mistakes that would eventually lead to those claims?
There are a lot of different technological solutions I have seen that help with this. One is a clinical decision making tool. So I'm going to give you examples of the technological solutions I have myself encountered. So talking about AI reducing errors in the health system, I have encountered quite a few tools that we have been presently using in various hospitals. One of them that I like is a clinical decision making tool that providers can use in the ER, and that can help them have a list of differential diagnosis based on the symptoms the patient is presenting with. And that can help us with better diagnosis and care for the patient. And this will definitely lead to a better patient outcome and improve patient safety. This is from the ER, not talking about the inpatients. In inpatient settings, we have seen adverse event logs being recorded by various hospitals internally, and they can pinpoint, this patient is sort of deteriorating or something went wrong with the care of this patient, and they can take steps in near real time to reduce the bad outcome for this patient. And hopefully once we step in a little early, we can provide better care for this patients once we know. And another thing we have noticed on the billing side, billing is also important in healthcare system. We have automated coding billing information. And apart from that, so AI is there everywhere in as a small tool, something we don't notice, something that is evolving, but it's there. And another thing I've noticed that I like is a lot of ORs and labor and delivery rooms use AI as a tool to record what's going on in the OR or the operating space. And they use that. They don't identify the providers or the patients, but they use that to develop better workflows in the OR. Like once this is how it's happening, so where things can be done better. So the workflow is improved once this data is analyzed. And apart from that, we also use this as education for residents or physicians. We just so AI is evolving. It's in all spaces in healthcare, just um, as small tools which we don't realize are actually AI.
What type of trends are you seeing from the AI data nationwide?
So the nationwide, when you say nationwide, data is huge. So I will share what I see with my own personal analytics. I'll share specifically in terms of surgery because we're talking more about surgical cases and surgical tools today. So I have noticed that, when patients come, have a surgery, something goes wrong, the same complication, like they have a puncture perforation or they have a retained foreign body. If it's identified in the in the OR, they have a second procedure to rectify it in the OR itself, which is the best case scenario. And then the patient goes steps down outside the OR, and then explain to the patient what happened and what we did to rectify it. This is one scenario. The second scenario is where the same patient has the same complication, maybe a puncture perf, maybe a retained foreign body, and we don't realize what's happened in the OR. This patient goes outside the OR. Everything is fine. This patient gets discharged home, and then he or she comes back a few days later, and they have the same additional surgery which they would have had for scenario one. But these patients from scenario two are actually more likely to sue. So what patients want is clear communication and knowing what can go wrong and having it rectified as soon as possible. So this is an actionable thing that I have seen we can use from the surgical data I have been seeing. So yes, if the patient had a complication, it's better if we can rectify it in the OR. So something like Census AI, which is also helping with counts, I'm hoping, like, if there's a discrepancy in counts, the patient is in the hospital, if we can start investigating and evaluating if the missing instrument is in the patient and start treating it early on and having a clear communication with the patient, that might reduce the chances of this becoming a lawsuit if the same procedure has to be repeated.
You recently reviewed Census AI Squared. Based on your evaluation, how do platforms like this contribute to risk reduction, particularly in instrument tracking?
So, Census AI was a very interesting tool. I can see how they automated a lot of processes in terms of sterilization. So, Census AI can help with sterilization, inspection, and maintenance of surgical instruments. It also counts the instruments, which I think is very important, like having a count of instruments before they go into the OR and after they come out of the OR is very important. For I'm just giving you an example. If I know there's a discrepancy in counts, that's when I can start thinking that there is a missing instrument and there is a possibility that it might be in the patient, and then we can start investigating and taking care of the situation before it evolves into an adverse event. Similarly, along for the data in terms of count, we also the inspection of the tools, like I was explaining about the drill bits, that's helpful. Like, if we know something is damaged, we don't want to take it in the OR. So that's where Census AI can help. I love the fact that they are also collecting data on the back end and creating reports out of it. So with data, the more we start doing analytics on it, the more we can actually use it for example, once I have this is a trend or a finding in this healthcare setting, we can use it as a theme for creating supervised learning models in AI that will help with creating new technological solutions dealing with the problems we are facing. So it's kind of using the information or the data that we have to create new technological solutions and tools. And I think Census AI can provide that kind of data. Something I would like to see is also integrating the Census AI with the EMR. Like, if, like I was telling you about the counts, the condition of the instrument, the techniques of the sterilization, like if we can have that embedded in the EMR, that will improve the defensibility of the case if it does become a lawsuit in the future. And also, I'm hoping with better and consistent sterilization technique, we'll have better patient outcomes, which will reduce costs for the hospital in terms of reducing length of stay for patients, in terms of these patients not coming back to the OR or not bringing in lawsuits. So ultimately, we want the best possible outcome for the patient. And I think Census AI gives us a good starting point with, doing the sterilization, the count. So I think it should be very useful for surgical patients.
Despite the benefits of AI and automation, we all know that adoption can be extremely slow. So, what are the biggest challenges that hospitals face when trying to implement new technology solutions? And how do you think leadership can drive that change?
Adoption of new technology solutions in healthcare space has always been a challenge. It's always a slow process, but we have seen that, eventually we are using a lot of technology in patient care now. So it's just a question of time, but involving the stakeholders early on, having them involved in this design process, in the testing, will help with, easing um, into the adoption of the technology. I would like to share a scenario like a certain tool was introduced in a hospital, and the patients, it was collecting information about patient care by nurses, and the nursing staff did not feel comfortable with the tool. So, introspecting and talking with them, the leadership realized that, they feel that the tool was used to audit them, and that's what was hindering the adoption. But, once they had a clear communication, like, this tool is not really collecting individual information, and the purpose of the tool is not to audit but to help, when they see that there is a gap in care, or when they see, their policies and protocols are not uh, up to the mark and can be changed with evolving patient care. So that's what the tool was doing. So just sharing the purpose of data collection, because many times this is new technology and people get a little worried about, what data is being collected regarding their work. So just, being open, honest, and explaining, and a lot of communication can help with such situations. I have also seen that getting a consultant or a user of the technology from another organization who's used it for a while to come and talk to the new user, it helps as well, because then they see a real life case scenario, which is not really theory, like how they're using it, what the pros are, cons are. And it's not that every tool or technology is the best, and that's why it is very important for us to involve the stakeholders, so we can have the checkpoints in place, we can have the cross checks where needed. And only when people are involved and a part of the process, can we develop the technology further. So it's not about saying yes to every technology, but about being open to using it, to seeing where we can make this better. And hopefully, in the crux is that everyone in healthcare wants a good patient outcome that makes all of us happy. So if we can somehow through these technological solutions get to that end point of a healthier patient, or a patient with a good outcome, that is satisfying. So I think, yeah, the communication.
If you could share one key piece of advice with hospital administrators and SPD leaders about reducing risk, what would that be?
We talked about this a few times, but I would like to detail this again. Two key things in the risk management space I have seen that we repeatedly talk about is communication with patients. That the patient should have a clear understanding of expectations after a certain surgery or a certain procedure, and documentation of the conversation with the patient, and what risks benefits were explained to them. And then apart from that, also documentation of the treatment plan that the physician or the provider has, along with a rationale on why that certain treatment was used. So that helps with defending a case. So if it does so the communication will help prevent the adverse outcome from to turn into a lawsuit, and the documentation, if it does turn into a lawsuit, will help with improving the defensibility of the claim.
Well, thank you so much, Dr. Hazra, for joining us today. It's been such a pleasure talking with you.
Thank you, Amy. Thank you for this nice conversation.
As always, if you want to learn more, you can visit census.com, or you can go wherever you get your podcasts. I'm your host, Amy Shadraff. Thanks so much for joining us today.